legislature or the Congress because they're not in session or because they just don't want to do it. But anyway, the bottom line is that the Affordable Care Act will look a little bit different, a lot different this time around with the tax credits not just made smaller but disappearing. And it is going to make a difference in a whole bunch of people's lives that may be sitting around this table, or you represent people that are going to be, that's really, really in a bad place. I believe that just in general, people will see, those people that sign up for the Affordable Care Act will see in the neighborhood of $600 per month reduction in that, so more cost for them. And that's about 136% difference. And I'll give you some Brown County information that is scary. If you're a 26-year-old in Brown County who makes $48,000 a year and isn't on their parents' insurance anymore because they aged out of that, they'll see a premium go up, costing them an additional $1,684. Middle-class family of 4 in Brown County could see their premium skyrocket 126%, and that annual increase of over, that is an annual increase of over $13,300. A 60-year-old in Brown County making $85,000 a year could see their premium rocket 279%, and that would be an increase of $20,000 additional cost. So we believe that we will, in the state of Wisconsin, have, I'd say in the neighborhood of 270,000 to 300,000 people in the state of Wisconsin that had health care will no longer have health care or can't afford it, but they will leave the system. Now, there's several things scary about that, but just in general, frustration that I think we all have is that this should be figured out in Washington, D.C. They don't seem to have the ability to get together and talk about it. And I think the Republicans in Washington are in a position to just make it happen. They're in charge. And that is, that's scary stuff. And think about the down range, what happens. People don't have health insurance. Where are they going to go when they're sick? The ER, right? They're going to go emergency room, and that has a boomerang effect to, we've seen hospitals go under in Wisconsin. The idea that ERs are going to be the place where everybody goes to get their health care is going to really cause havoc with our hospitals too. And on top of that, just step away just for a second away from health care, I always like to talk about the possibility of connecting the dots to make people's lives better: education, affordable housing, transportation, health care, and food plays a role in that too. And we're also adding to that misery with food share being not part of the program anymore. Where hopefully we can revive that, but that's the bad news. And I'm going to let the secretary go into more detail, but I don't want to start this out in a negative way, but I've thought about this. I've been all across the state. I don't know how the hell to make this a positive discussion. And so there it is. You got Evers at its worst, but it is not good for people in Wisconsin or our country. So with that, my friend, take over.
Talk about the opportunities to address these challenges. No, I'd love to get started just by introductions. Just please share who you are and who you represent. And then we really just want to open it up to a conversation to hear from you and to be able to answer any questions you may have about what's happening. So let's start over here.
I'm Devin Christensen. I serve as the director of the Aging and Disability Resource Center here in Green Bay for Brown County. We serve folks who are 17 years, 6 months to the end of life. So it's a large spectrum of individuals. We help connect them to resources and are helping to navigate open enrollment, SNAP benefit changes, food, transportation, all of those things for people.
ADRCs are some of my favorite places.
I know, and we thank you for that.
Yeah, you do great work.
Hello, my name is Natalie Bomstead, and I'm the executive director at WLO. WLO is a nonprofit collective well-being strategy firm, and so we actually work across different sectors, really looking at those gaps that systems might have and really rooting them in what community needs are and really finding opportunities and ways in which we can work together. Some of that work earned us the Robert Wood Johnson Foundation Culture of Health Prize in the city of Green Bay this year. And so really looking for what are some of those opportunities and some of those collaboratives that can really find some potential strategies and stopgaps. And ultimately looking at how are we driving systems transformation so that, you know, regardless of what time it is and what year it is, we can find some long-term systemic solutions to some of these issues.
Nice.
Ryan Spouty, State Representative, 89th Assembly District. It's my honor to represent the west side of Green Bay and the village of Ashwaubenon in the State Assembly.
I'm Mel Olinger. I'm not sure why I was invited. I'm a very passionate person when it comes to healthcare. I'm a small business owner and a Navy veteran, a mom of two, and I have been, we just celebrated our 7th year as owning a small business. So I think that might be here for MSA. They are called Main Street Alliance. But early on in our business journey, we found that the healthcare side of things was extremely difficult, extremely expensive. And when we used the calculator, our family is going to increase by $15,500, which is kind of crazy because I get free healthcare as a veteran, but my husband and my kids do not. So we aren't big enough to have those big corporate negotiation chips. And for me as a business owner, I found that businesses and their connection to healthcare, I think is a violation of privacy. Because when I first set ours up, we had it for 3 months, and it was $2,500 out of pocket for everybody, which is just not even affordable. And I could see who went to the doctor, well, not who, but how many times people would go to the doctor and their gender. And because our team is so small, it was very easy to figure out. And I think that because healthcare is such a charged issue, that if we were to talk about it in relation to privacy instead, to remove it from small business and just business in general, that we might have more success.
Great. Thank
Hi,
you.
I'm Shruti Sriram. I'm from Brown County United Way. We recently joined them as the Chief Impact Officer. And Brown County United Way has, I think healthcare has been a very critical part of what we've been focusing on through our advocacy efforts, through our childcare collaboratives, through, I think we have Hubcap, which is a mobile fleet, which we try and take services out into communities. So mental health is something that has come across very strongly for us. And of course, in our granting work, I think healthcare, and particularly mental health and community connectedness have appeared as extremely important gaps in the community. So yeah, very interested in know what this group has to say as well.
Thanks.
Yeah. I'm Jamie Wall. I represent the Greater Green Bay area in the State Senate. And in my previous life, I was on the ACA exchanges from their inception until my state healthcare kicked in February 1st of this year.
My name is Carl Wadekitis. I'm with the governor's office. I will be taking notes and helping with any follow-up.
Good morning. I'm Jennifer Webster, council member for Oneida Nation, representing 17,000 members worldwide, and then within Brown County, 4,000 to 5,000 membership there. Thank you for having us.
You're good. Thank you.
I'm Janie Black, and I'm the Wisconsin Field Organizer for Moms Clean Air Force. We're actually a national organization, 1.6 million moms, dads, caregivers, all united to protect children's health from air pollution and climate change. It's what makes us really unique is that we're always, looking out for the kids. And so I represent 17,000 members here in Wisconsin. You can't take care of kids' health if you don't have health insurance, so.
Well, thank you. I think like I said, we really just like to open it up for comments or questions, anything you'd like to ask of the governor or me, and what we're thinking about in terms of what's happening over the next 7 days, and then, subsequently over the course of the next year.
I'll jump in. I was knocking some doors talking to my constituents yesterday, actually. And folks are very much aware. In Washington, you've got the president demolishing the East Wing. And folks are asking, why do we have money for a gold ballroom and not for healthcare and food share? Just laying that out there, that is something very salient. People in my district are seeing that, and they're picking up the phone or emailing me saying, what's going on? Why can't we? And I have to explain federal and state, but I think it's cutting through the noise, what's going on in DC.
That's good.
Point.
I guess just a question, I think I know the answer, but I'm not 100%. So the same Trump budget has some big changes and big cuts in the Medicaid program, but they're delayed until after the next election, all right? The people who are going to see their premiums go up dramatically on the ACA exchanges, they're generally making too much money to qualify for Medicaid. And that's a true statement. Are there any other sort of legal impediments there that would prevent somebody from transitioning from the ACA to Medicaid? Should their incomes permit it?
If they're income eligible, they should be able to transition to Medicaid. I think the challenge in Wisconsin, and Governor, you can certainly speak to this as well, is we have used the marketplace as our stopgap for people who are between 100 and 138%. Because we didn't expand average income, right? We didn't expand Medicaid to cover that population. And those are the very people who are not going to be able to afford those subsidies and are going to end up uninsured. So we have, the risk for us is greater because we have never expanded Medicaid in terms of the people who become.
And we've tried.
Yes.
Multiple times we've tried. Not successfully.
For me, it's heartbreaking because I represent, myself who has stories. Why I do the job I do, I'm so passionate about it because, I have a daughter who has multiple sclerosis and she needs her infusions and she needs her medication. I have a son who has asthma, he needs, and all of that costs money. So I think about the 20,000 people in Wisconsin that also have MS, and there's 75, I think, 1,000 children. If this happens,
Right.
what's going to happen?
What the alternatives are.
Right.
There's no good answer.
I can say that our Medicaid program, we are in a better position than many other states financially. So what we pay was approved in the biennial budget, but the governor's budget went through. So we are not faced with what are we going to cover or not cover under Medicaid right now, which is unlike many other states. Many other states are faced with very difficult decisions in terms of our only options are what do we cover, who do we cover, and how much do we pay for reimbursement. Those are sort of the three decision pots that we have at DHS to think about Medicaid. And we're not right now in a place where we have to make any of those tough decisions. Other states are. So to your point, people who are currently covered by Medicaid will continue to have their coverage for their critical services and medications and treatments. But if you're in the marketplace and you fall in that gap and you can't afford it, there are going to be very real impacts for Wisconsinites and for families. And aging adults.
What happens, you guys had talked about that ER cost. What happens if people are going to the ER and they're not paying it, doesn't it just mean everybody ends up paying it anyway? Yeah? How? Like, how does that end up working?
So,
Have at it.
the issue is that what's gonna happen is people go to the ER for their primary care. Fortunately, again, in Wisconsin, we have a very robust system of federally qualified health centers. So we have health centers all over the state for people who are uninsured or underinsured or covered by Medicaid. But they only have so many resources too. So at the end of the day, people know that they can go to the ED, they're gonna show up in the emergency department. It costs a lot of money to go to the emergency department, regardless of why you're showing up, whether you have an ear infection or a broken arm. It costs a lot more money to go there first. Those costs, those hospital systems, it's called uncompensated care. So they know they're not getting paid. They're going to bill people anyway. People are gonna end up taking on medical debt. They're not gonna be able to pay for it. And those costs will eventually be, they will be sort of carried forward or brought down to the commercial market and to employer-covered insurance. Somebody has to pay for it. And the cost is gonna be to everybody else.
So if there's something that happens in place before that, is the government able to negotiate a better price for those services to keep costs down?
So we can negotiate with Medicaid at DHS. That's where our negotiating power is. We negotiate those rates with those health insurance companies. Medicare is negotiated federally. And then our commercial plans, they work with the Office of the Insurance Commissioner. But at the end of the day, hospitals, and they need to be paid for the services they're providing. And then when people, and like the governor said, pre-November 1st, pre-January 1, we had roughly 90,000 people uninsured in Wisconsin. We're looking at closer to 270 to 300,000 people who are not going to have insurance. That's a huge number, and it's going to have a huge impact on our hospitals, on the whole healthcare system.
Well, we know that drives costs up overall, for sure, over time. I think it's always a trickle effect as well, right? So what we see is individuals who are in the hospital, they're trying to discharge prematurely because they don't want them, they may be very ill, so they're going into observation, and we're having, for the first time in our history, people being discharged to our lobby who don't have housing, who have nursing care needs, and there aren't facilities who will have those people be admitted because they can't be guaranteed any insurance as well. So the trickle to that is that unpaid family caregivers are leaving their jobs to try and provide that care, becoming more and more stressed. There isn't food share available for food to keep people well. They're leaving their jobs. They don't have their health care. And then people begin to rack up incredibly bad credit. And now we have another housing issue for those folks who might get evicted and then they can't find additional housing. And it can be a very dismal story if you take it all the way through, but it is really, really disconcerting. And the other thing that we've seen most recently is the senior employment programs that were slated to move forward, but then were taken out of the president's budget federally. This was a subsidized employment program to help older adults who are low-income work. We had 11 folks on our staff who have been working for 30 years over time with us. All of those individuals lost their jobs with a 2-day notice. And then given the requirement that should they need food share, which they definitely now qualify for, they have to work. But their employment support was taken. So now people who were working and had food and were able to pay their rent are now put in an impossible situation, and they need health care as their chronic conditions aren't managed. So they went from workers to customers of our agency in 2 days. And so it just feels like a impossible mountain for people to climb, because everything that was going to help them do the things that they need to do, which we're being told by administration is what they need to do. We want people to work. We're taking away every benefit to help people do the things they're being asked to do. So it's this terrible slippery slope that may look at first blush, well, people should work, so we're going to have them verify that they're working, not realizing what it costs more to try and do that these are people with disabilities and are struggling waiting for disability. They aren't able to do full-time work, and we just create mountainous efforts, and then no one to talk to, because there are not employees on the other end of the phone to actually help navigate that through. So this impact it's huge on all the organizations who are trying to help and can't keep pace with it.
Just just to put that in perspective, you said you expect 300,000 people to be
Uninsured.
underinsured after this, but that was starting from 90, so you're picking a couple 100,000. That's still, if my mental math is right, maybe 3.5% of the, 1 in 30 people in Wisconsin, okay? That means every single one of us is gonna know a human being who is directly affected by this. We all know 30 people, right? This is not the worst thing that's coming out of this, but one thing that always strikes me, one unfortunate side effect of tying health insurance as closely to employment as we do in this country is that you discourage people from entrepreneurship. If you've got to leave your job with a big company, oh gosh, what happens? What's going to happen to my health insurance after that? And if you don't have relatively affordable options, there's people who are going to choose not to pursue their dreams, to owning a small business. Maybe not everybody's going to make it, but some of them, they're going to own a small business that turns into a big business that's going to drive our economy in the next decade. So this is not, it's a terrible human cost, but I think it's also kind of a hidden tax on economic vitality, the way that we structure our health insurance in this country.
I jokingly say that tying our health insurance to employment was the original health policy sin, because ultimately that has driven so many of the challenges that we experience in healthcare. And it's also added a value statement to you don't get health insurance unless you're employed with a large employer. And that is not at all the case. Everyone deserves access to healthcare.
Yeah, I think to build on that, I mean, we're a small employer as well as a nonprofit, and the costs are just astronomical to provide that, right? And we hear a lot of stories in the community of folks who are entrepreneurs, right? But maybe it's a partnership, and one of them has a pre-existing condition, right? And now are covered under the
Right.
Affordable Care Act, but
Somebody's kid gets sick and you went
exactly.
bankrupt your
Now what
business.
happens,
Yeah.
right? And now you can't do
Right.
that business, even though that business is driving economic activity within the community. It's something that's really purpose-driven, and now those families, where are they gonna go, right? And if you're defaulting to just where can I get insurance, and we've even heard from large corporations that even their costs have gone up threefold in the last few years. So it's not something that only impacts that small business, also large corporations, and that has impacts. That has to come from somewhere, right?
The last thing we want to do is ration our healthcare.
No.
I don't want to make this overly political, but it's my business. The state government is open. I've got folks who are confused. Is the state government open? We're open. We did our job. We passed a budget. Who's in control of the federal government?
Right.
This is the Republican Party.
The people that aren't working,
Yeah.
right?
What is the president doing overseas right now? Why isn't the House of Representatives in session? I would love for my president, my congressman to get their butts on the next plane and go back to DC. I would love for someone to put them in a room, and they can't leave until they make a compromise to reopen the federal government. That is, I'm banging the drum on this. Just wanted to-
I think it's really crazy that people can work and have these jobs and just not go and keep these jobs. Like, up until we started this, like, I was working, you were working on your computer too. Like, normal people, we have to work all the time. So I find it just so embarrassing that we have these people representing us who do so very little in their actual line of work to represent us. And they still get paid, and they still get to keep their jobs. I would've got fired so fast.
Yeah, and as you make these calls to your folks in Washington DC, because I get this, and I'm guessing some of the media today will say, well, what about, they said, if you do X, we'll do Y. Doesn't matter. That doesn't matter anymore. They just need to go to work and solve this problem. It's as simple as that. I don't care what they talk, it's like two children. Somebody says this, and then somebody says that, and then you sit there and wait till they're done being angry with each other. Well, all the while, all these things are happening that frankly just shouldn't happen. So feel free to call your state or your national representatives, for
We,
sure.
at our house, we've gotten a little salty about it, especially with the SNAP food stuff
Yeah.
coming up. That, my husband and I, we've been calling Kroger and Walmart and all these major food chains, because if somebody's going to hurt from not getting SNAP benefits, who has the lobbyists and the money behind them to do something, I was thinking maybe it'd be them. And then yesterday we heard that Walmart did get involved, and I was just, well, while I'm not always go corporation, I was yesterday, so.
I do think that's the strategy right now, is we're hope the Grocers Association is powerful. They stand to, so Wisconsin alone, is $114 million a month is spent on food, through food share. That's a huge impact on our grocers and our local, and our Walmart, everywhere people buy food. $114 million in November is gonna be taken out of our economy that supports all of these, or small businesses, larger
Well, and you
businesses.
can take it a step back into,
Yeah.
into farmers and the ag.
Right,
market
exactly.
Too, right?
Right.
Where does their money come from?
Yep. So,
I was one of those moms on SNAP 20 years ago, and if it wasn't for those programs, I wouldn't be where I am now. It's only because I got to go through college and be able to feed my 4-year-old kid as a single mom. And when I hear people talk negatively of these programs, I was just like, my whole life is because those programs, and those couple of months where you go from, you finally have a job that you no longer qualify. It is so very hard to stay out of it and get to the next. And it took us 6 months of living very, very uncomfortably until we finally got to that point where everything was starting to be okay. And so when I see people that they're going to not have that anymore, I don't understand how they're going to get by or eat. So we're giving out ramen noodles for Halloween this year.
It's a good
I know
idea.
it's not a lot, but
You were wondering why you were here? This is why you're here.
I think they did all right.
Yeah. I think there's also a belief that the food pantries and like we run home delivered meals and donation-based programs will have enough to fill the gap. And like the average age, I was listening to a news program recently, the average age of the pantry volunteer and worker is about 75. So the older adults who are actually needing those programs are also putting back into it as volunteers. And that as they are not able to maintain that themselves, there aren't even people to help do this, let alone the food. And we have a limited budget, so all of the folks, we've always seen a huge uptick in people coming to try and eat a donation-based meal, and which is fantastic, which is what we're about,
Right.
but we can't fill this gap like by any stretch of the imagination. And then folk coming and saying, what do we do? What do we
Right.
do? What do we do?
And in the best of times, if I'm remembering what the people at Paul's Pantry, and they're the biggest pantry in the county by far, I think they told me they touched something like 12 or 15,000 people over the course of the year. So that's 5% of Brown County, and maybe they're half of the food pantry market. So you're talking about, maybe 10% of our neighbors who step into a food pantry at some point over a year. So it's not like, I'm sure if, your food pantry and the others, you don't have a ton of slack. It's not like you've got an extra 50% of food that's sitting around going to waste. So the rubber's gonna hit the road here, very quickly. And, philanthropy is wonderful. People can and should be generous to help their neighbors, but it's not a sustainable solution here.
Well, and at WLU we have something called Cultivating Community, and it's really about regenerative local food systems and really moving from just a cost basis to a value-based procurement model, right, overall to that point. And we've seen in the food system space, even some of those federal grants and state level federal grants that trickle down to the state level, those have been rolled back. So it's not like this is the only thing happening right now. In the overall ecosystem, there have been a ton of pivots this year, more than I want to. We're dizzy, right? So it's one thing after another. Especially when you think of food systems, our pantries are amazing, and right. What if people actually had the benefits they needed to be able to feed their families, right? This feels like a very foundational element of any thriving community, right? And what do we want America to look like, right? If people don't have access to affordable health care, if they can't feed their families, you're talking about families and young kids, you know, going to school hungry, and we're trying to fill all these gaps, and we have wonderful members of our community who are very generous, but there's just too many holes in the boat, right?
Yeah,
And so
right.
at some point, right, you have families who are gonna be losing, you know, money for their housing, they're losing dollars for food, they're having to do, you know, childcare is expensive, so there might be, you know, what does that look like from an employment standpoint? If one partner has to stay home, right, that's a reduction in overall income. So it's kind of all of these things coming together that
Right.
is really worrisome when we think about what do we want Wisconsin to look like, and what does our future look like in terms of being healthy and
Right.
thriving.
Yeah, and in our world, we talk about that as connecting the dots, and whether it's healthcare, whether it's transportation, whether it's affordable housing. There's several that, they all work together, and if you're pulling on one, you're pulling on them all. And these are two huge ones. So you think about how it might work out with kids in school that no longer are able to take their lunch from home. It's not gonna happen. So now they're relying on the schools, whether the schools have the wherewithal to do that. Things can fall apart real quickly, real quickly.
We have close to 700,000 people in Wisconsin who receive SNAP benefits, and almost 100,000 women, infant, and children are on WIC. So WIC is also at risk. We have enough money to pay for WIC through most of November, but we still don't have a hard date, recognizing that there's going to be greater demand, given the fact that SNAP benefits
Yeah.
aren't available.
So where's the point where, where will the state be able to be at what point that you say, this is like, we have to watch this just happen, or
We're there.
we just
We're
watch?
trying to hold
When
them-
there
Yeah.
is there wealth in this country, I guess, philosophically, to have this not be the case?
You would think. If, I'll use the SNAP money. The Department of Agriculture has the money to keep going what they do right now. They have it right now. In fact, we just took them to court today to say, quit telling us you can't do this, because we know you can do this.
They have money set aside, in fact.
Course.
Particularly specifically for a rainy day, and it's
Yeah.
about to rain.
Right, and so that's one thing we can do. I mean, we have, you know, we don't print the money like they do in Washington DC. And so in order for us, we would never be able to take on the America Affordable Care Act. I mean, it's just too big. It costs us a lot of money just to operate it, more or less, fund the whole thing. So that'll never happen. That'll happen out of Washington DC, has to. They can print it if they have to.
With healthcare, one of the things that we found was two ways that we were able to find more affordable healthcare was through Common Ground, which was canceled in most counties a couple of months ago. But it's very weird, but just a couple months after we had gotten off of Common Ground, we signed up with Network Health, which is a Wisconsin-specific one. And that has been the most affordable one for this year. So we just keep holding out some hope that maybe they have some sort of solution for healthcare, specifically for Wisconsin, because I don't have any other ideas, really. I know we can't pay an additional $16K every year. Things are squeezed so tight right now. I just got back from, I know this is gonna sound fake, but it's real, the car wash show in Europe. And it was in Amsterdam this year. And I went to the grocery store, and blueberries there were equivalent of $1.65 for an entire pint. And I came back here, and they were $6.99 for a pint, and then $4.99 on sale, and then 50 cents off the coupon. And just like the cost of food is so much. So like even if we would magically have all the food benefits and everything back, there's still this crazy amount of what things cost versus what their value is, and we're seeing that in all sides of our business. So with the industry we work in, it's very conservative, and it's the kind of noisy, angry conservatives that are saying all the stuff that you can imagine. But even with them, the owner of Cheetah Clean, who is extremely conservative man, said healthcare with business is bullshit, and I just couldn't believe that he would say that. He's so tired of spending so much on healthcare when those vacuum systems cost like $3 million to install, that he could create another site, another job, another whatever, and they just have to keep pouring money into healthcare. So.
Well, this is to your
Well, there's a
point.
solution.
Well, no other country makes businesses have to
Right.
worry about
It's not
healthcare for
tied
their
to employment.
employees. I mean, on the margin, you'd rather have that guy worry about how to build a better, cheaper, more efficient, whatever vacuum system for his customers, right? Instead of having to spend 20% of his time worrying about pricing insurance plans out in the marketplace. And I guess one other thing we haven't mentioned here is that you've got to worry about what this is going to do to the health insurers here as well.
Sure.
This is going to destabilize,
Oh, yep.
the private health insurance market in the state. If you take all of those customers out of their pool, the way this works is generally the bigger the risk pool, the more insured people you have, the more stable and predictable your business is as a health insurer. So if you take 210, 300,000
Yeah.
Wisconsinites out of that, okay, you
And
gotta-
if you take out the
you
young,
better-
healthy people, who are going to be the
Right,
first
who are
to
the
drop,
ballast in your system,
Right,
right?
right.
You better be on the phone with your actuarial department right quick, or
Yep.
you're gonna be in trouble.
Right.
Yeah.
What's United Way here in the scene? Don't mean to put you on the spot too much. I'm curious what you guys are here in the scene.
So let me preface this by saying that I'm new to the role, and I'm new to, well, the United States, and as an immigrant who came in last year. The healthcare system has always shocked me. I was very surprised last year, so this is more of a personal story. But just a few months back, I had a small cut on my pinky finger, and it cost me $258 for someone to put glue in it. And I was shocked beyond my wits that I had to pay so much, and I converted it into Indian rupees, which was just phenomenally high. I could have got it done for 1,000th of the cost if I were in India. So I think the healthcare system in the United States has always baffled me. I think as an immigrant also it concerns me more. Some things that we've been hearing actually from the immigrant community is challenges with language. They don't have translators. So I heard just today from someone who I was talking to, and she mentioned that an infant actually died because a Latino woman could not have access to a translator to be able to actually access affordable health care for their child. So that's one thing I think that we're hearing from our community partners. And of course, we do work through our funds, largely through the funding that we do, and we hear a lot around lack of access to mental health, which is something that is very concerning. We try and sort of support that access, but it's only increasing. So, the wait times that people are experiencing to just even access a mental health care appointment significantly higher. And I think that is only going to continue to burgeon as this problem sort of, goes out of hand. School students, young adults are facing increasingly high mental health care challenges as well, and not being able to find slots. We don't have enough practitioners to support with, therapy. So those are some things that we are seeing more in community, and those are the kinds of things we've been funding over the last couple of years, and that's just burgeoning over time.
Well, and there are already dramatic access issues to healthcare just about everywhere, and we have our problems here in Brown County, but if you get out into rural Wisconsin, oh my goodness, in terms of doctors who are willing and able to practice there, in terms of access to skilled nurses, to dentists, you name the health professional. And again, if you're taking a lot of paid care out of the system, where is that going to have the most dramatic impact? I mean,
Right.
that's part of the answer.
Yeah.
Right there.
For sure. Some carrier, insurance carrier in Price County
Mhm.
might have 2 people left in Price County.
Mhm.
They will leave Price County. I mean, it just makes no sense for them continue providing health insurance there.
This shifting, the cost shifting too is something, is really gonna be concerning from the feds to the state each year, reducing the percentage of match. It's like slow and insipid bleed that is gonna be happening over time, that the state is gonna be faced with really tough decisions that will look like the state is making the decisions, when indeed it's actually being brought to the state. And
Right.
so it feels like we're politicizing healthcare in a way that we're trying to have other people look responsible for decisions that are being made today. And then I would say, just from a county perspective, counties saying, how can we possibly then take the cost shift that's trickling down to the local level? And because none of our levy bases, et cetera, are going up to keep pace. And then the county will look like it's making decisions when it's being given very difficult circumstances as well. So every coffer is getting eaten away when the cost of operations is just too great. And I know you know all of that, but it is really like trying to bring the information out so we can identify what the real decision that's being made here is about tax breaks, and that we actually don't have to do this. But because of that, it's occurring, and it looks like something other than what it is.
I have a question.
Sorry. I was just curious what you mean about the tax breaks. I don't know the connection.
Go.
Want me to, I can.
Yeah,
So twofold. One, I think what is happening federally, what happened with HR 1, the cuts that we are experiencing, or that we will be experiencing in Medicaid, specifically in Medicaid, but also in SNAP and across the board in terms of what's in the president's budget, which we're not voting on. But the costs in the HR 1 specifically, the One Big Beautiful Bill, for example, the administrative costs that are being passed on to states, just for Wisconsin, this is just Wisconsin, and just in the next year, it's gonna cost us $142 million just to implement the administrative requirements of the bill. It's not extras, resources for people, that's not additional food, that is straight just what we are going to have to pay administratively. So it's $284 million over the biennium, just to implement the administrative burden that is now being required by the bill. It's very deliberately targeting states and making states have to make really difficult decisions on what types of services we provide to people.
But it's too
And
stupid
it's
for words.
so that these billionaires and
Right.
companies can continue to get bigger tax breaks. So
Yeah.
they are not paying less into the system. This is absolutely unnecessary. This does not need to happen. We can afford to pay for all these services. And it's very deliberately targeting,
Yeah.
assuring that the wealthy stay wealthy and everybody else who needs these resources that help us be successful business owners, live healthy lives, are gonna have more, it's gonna be more difficult.
But the worst part of that story is the state is gonna have to
Yep.
spend $284 million over the next few years on additional bureaucracy
Yep.
for the specific purpose of taking people's healthcare coverage away.
Yeah.
right.
That's what that money goes for. That's a weird set of priorities.
Right, well,
That's the exact opposite of efficiency.
Right, it's making us less efficient and less effective with fewer resources.
Under the
And-
guise
and
of
cutting
fraud, waste, and
taxes.
abuse.
for wealthy people.
Right.
So my question is, what are the options that the state has? And what can the nonprofit community do?
Well, we don't, we have very few options. Yeah, I mean, I suppose we could say, well, we're gonna take this over ourselves and increase taxes by 50% on everybody. I suppose we could do that. That would never happen.
No.
That will never happen. The issue is making sure that the federal government does their share. Simple. They need to quit giving breaks to people, tax breaks that they don't need. And they need to be partners with us on healthcare.
And how does one make that happen in the current?
Well,
political
there's you have somebody that works for you in Washington DC that hasn't done, I haven't seen him go to the floor of the Capitol and say, you know, we gotta do the right thing for the people of Wisconsin. I haven't heard that yet. You may wanna give him a call.
Because we know he's not doing the town hall here either.
Yeah.
I was struggling with that over the weekend, and I realized we have really no good options at the state level. A couple hours ago, I was posting on social media, here's a list of food banks and food pantries in and around my district, including the Oneida Emergency Food Bank. That's where I'm at. I'm encouraging folks, if they need help, to go to these food banks, these food pantries, and if you are able to make a donation, please donate, please give. It feels ridiculous, but that's where I'm at on all these issues as they all converge together.
I mean, I was at a charity fundraiser for local food pantry on Saturday nights. I mean, people are trying to step up. It's just that the feds have got by far the biggest checkbook in the country. You know, the state of Wisconsin is a big organization and not without resources, but we pale in comparison. And there's just not enough slack, and so we're back to private philanthropy and good people doing the best they can, but that's not a solution here. That's going to get us through Thanksgiving if we're lucky, and Christmas if we're really lucky, right?
Yep.
And then what happens?
Yep. I would just add my last comment is I think under the governor's leadership, every single agency within the state of Wisconsin is trying to be strategic and as efficient, as effective as we can. This whole idea that there's waste, fraud, and abuse and that's where the money is going is absolutely untrue. We have our own inspector in general and DHS. You know, it's important to me, it's important to every single person that works for the governor that we are responsible with our tax dollars and that we are investing them in the communities and in the people who need those resources most. And I could speak for everyone on my team and every one of my colleagues across the entire state, all the agencies, that we all feel the same way or we wouldn't be in these jobs. And it's, I think, just such a disservice to Wisconsin, what's happening federally. And I will hand it over to the governor for the last remarks.
Call them.
Yeah.
It's go time now.
Your federal representatives,
Federal
your senators,
represent-
your congressman,
Absolutely.
person.
And don't let them, they'll go immediately to, well, we can't go to work because of X or Y, because somebody over here said something else. They have to solve this. They alone can solve this. They need to go to work. Simple as that. Make it happen.
Yeah. Well, thank you, everyone, for coming.
Answer, though.
Yeah, yeah.